by moderating and kind of keeping the session flowing in the background. We are recording this session so that it's available to others in case you're not able to join or stay for the whole session. And yeah, so it's my pleasure to welcome you all to this side event of the N4G Summit with a focus on operationalizing multi-sectoral nutrition programs to accelerate progress with a nutrition governance perspective. So welcoming everyone to the session. I want to go through just a couple of framing slides before I hand the mic over to our two opening speakers. So if we want to go on to the next slide, just to highlight, what are we hoping that you all get out of this 90-minute session? We want to highlight the critical role of governance in operationalizing large-scale multi-sectoral nutrition programs. We also want to give you the opportunity to take away some lessons learned from various country experiences with strong nutrition governance features, and maybe walk away with a sense of what needs to be done by countries and our partners to help continue to strengthen those governance aspects. On the next slide, we share with you just a general sense of the session flow. So you get you kind of know where we're headed. We have a range of fantastic speakers who are joining. We're going to have Mr. Takahiro Tsuda and Dr. Juan Pablo Uribe in just a moment offer some opening remarks. We'll be inviting our co-authors, Julie Rule Bergeron, Ali Winoto Subandoro, and Sylvia Holschneider are our co-authors of the report, and they will be offering a brief presentation, which will be followed by some specific country experiences, hearing the voices of our country colleagues, and we'll introduce those a little later. We'll do some Q&A, see if you all have some curiosities about that, and then we'll move into a panel with our partners. And finally, Ms. Gerda Verberg will offer us some closing remarks. So that's just a little bit of a roadmap of where we're headed in this session, which I suspect is going to go by very quickly. A couple of tech ground rules, which I'm sure you're quite aware of at this point in Zoom. We welcome you to our Zoom space. At the bottom of your screen, you have the ability to navigate the panel and do some different things as needed. For example, one very important thing we want you to do is to choose your language, whether you're preferring to hear in English today, whether you're preferring to hear in Spanish or in Indonesian. At the bottom of your screen where it says interpretation, you want to select the language of your choosing and be in that room for the session. We also want you to engage in this session in the chat box. It's a great place to offer a response to a question that a presenter might be posing to us, a question you have for each other, for speakers, or a reaction and a comment. So please feel comfortable populating the chat box. We may not address all comments, but we do want you, on that next slide, we're reminding you to please do engage with the chat. And then just a few meeting norms, as is best practice, we often highlight them. Be present and engage, take advantage of this opportunity to learn with one another, from one another, be curious and ask questions, as I mentioned in the chat box. And of course, we invite you to make sure you help us mute yourself when you're not speaking to avoid background noise. We also have the ability to mute folks, and we'll do our best to do so. So with those very brief framing comments, it is my pleasure now to, on behalf of the GFF, to introduce our two opening speakers, Mr. Takahiro Tsuda, who is the alternate executive director for Japan and the World Bank Group. And we also will be having Dr. Juan Pablo Uribe, who is the Global Director of Health, Nutrition, and Population and the Global Financing Facility of the World Bank. We'll be hearing from each of you in turn just to help us frame and kick off this session. So with no further ado, let me first hand the mic to Mr. Tsuda.
Thank you very much, Stephanie. It is a great pleasure to be here. Colleagues, hope everybody is safe and healthy despite the proliferation of Omicron variant. I thank all the staff at the Global Financing Facility for this great opportunity. First of all, I'm very happy to share with you that the Tokyo Nutrition for Growth Summit was successfully concluded. It highlighted the critical importance of nutrition for the society to reach its full potential. It sent a strong message to the rest of the world that investing in nutrition is one of the key ingredients for developing the human capital, enabling resilient, inclusive, and sustainable growth. Today, I will briefly speak about the role of GFF, multi-sectoral approach, and Japan's contribution. First, the role of GFF. In nutrition space, the GFF is a unique contributor. It helps achieve key goals of the Nutrition for Growth Summit, including the integration of nutrition in universal health coverage and the steady, sustainable financing for nutrition. The GFF has applied a collaborative country-led approach, which has demonstrated significant improvements in access to quality health and nutrition services in an affordable manner. As such, the GFF has played a leading role in tackling maternal and child mortality and improving nutrition across the board, even prior to the COVID-19 crisis. It has proven to be instrumental in helping each government identify priorities for women and girls, improve coordination at country level through joint investment initiatives, and address bottlenecks. Speaking of joint investment, it is also essential in increasing health financing from the World Bank and from partner governments. According to the GFF annual report, the share of IDA financing towards women and children's health increased by 37% following GFF engagement, showing the power of co-financing in mobilizing more financing targeted to improving health and nutrition outcomes for women, children, and adolescents. Second, I'd like to speak about the importance of multi-sectoral approach. The COVID-19 has led to a health crisis in many countries due to disruption of medical services for women and children. At the same time, very unfortunately, this pandemic will not be the last one. We must further strengthen the health system for prevention, preparedness, and response. Once again, promoting universal health coverage is a key. Taking a multi-sector approach to improving nutrition outcomes will help nations, countries, regions to address the crucial underlying determinants of malnutrition and position the world to achieve the Sustainable Development Goal 2. That is the eradication of all forms of malnutrition by 2030, as you all know. As we will hear today, I hope, the implementation of multi-sectoral programs requires strong governance system. Among others, strong governance system includes strong political leadership, institutional coordination, effective monitoring systems, wider citizen engagement, and sound public financial management system. I think today we are very lucky because we can hear a lot from distinguished speakers about leading experiences that have successfully included strong governance elements in the support programs. Lastly, let me share with you Japan's contribution. Japan has been a strong supporter of the GFF. We have committed an additional $50 million pledge to the GFF as part of a broader commitment at the Nutrition for Growth Summit. For the IDA 20 replenishment that was concluded last month, we have supported the human capital elements, including maternal and nutrition service, as one of its key policy commitments. We have the high aspiration to ensure, as an IDA donor and the partner of the GFF, that the nutrition remains a top priority as the world mitigates, controls, and then recovers from this pandemic, including through full integration of nutrition in the universal health coverage agenda. We look forward to continuing the partnership with the GFF and wish you a successful event today. Thank you very much. Back to you.
Many thanks, Mr. Tsuda. And again, we have two opening speakers, so I'm now handing the mic over to Dr. Uribe.
Thanks so much, Stephanie, and it's a pleasure to follow Taka in these welcoming remarks. Very happy to be here, and hello to all of those attending. I want to start by congratulating the authors and all of the staff in GFF for this work and for the work they do day by day, which is extremely important for so many. I also want to praise the government of Japan for its incredible leadership globally on nutrition and on so many aspects, TACA, all our recognition. Now, if the COVID pandemic has shown us something, in addition to the importance of closing inequality gaps around the world, it's the importance of having well-functioning, highly performing primary healthcare systems, being able to have strong healthcare systems in all of the dimensions, and moving towards universal health coverage. However, underlying those valid expectations and incredible challenges that we have as we walk out of the COVID pandemic, there's a sine qua non. There's a must that health systems will need to have in order to develop those performance characteristics that we all are expecting. And that underlying sine qua non is sound governance. Exactly the same happens in nutrition, only that may be even more important because of its multi-sectoriality consideration. In nutrition, absolutely essential for health, for development, and for the well-being of individuals and families and communities, the contribution from many sectors, organized and simultaneous, has to be there for the impacts and the outcomes to follow. As Taka very well highlighted, governance implies, to start with, a shared and clear purpose, a clear determination. Governance also implies maintaining throughout the whole effort a decision-making capacity that really takes into account data and close monitoring and evaluation. It implies sound management and financing systems that can follow the decisions and the flow of the resources. It also implies transparency, accountability, participation. Finally, it implies strong leadership. For our capacity in our countries to advance in better nutrition, we will need to bring together multiple sectors and multiple leadership and participation around a framework of sound governance. The good thing today with this challenge in front of us is that we're going to be hearing from countries like Guatemala and Indonesia, like Rwanda and Cambodia, and we're going to be listening to excellent panelists from USAID and the World Bank, from UNICEF, and from the Scaling Up Nutrition Movement, who combine the what needs to be done with the how to do it. So they are going to be able to today to show us that with sound governance, a multi-sectoral functioning approach to strengthening and improving nutrition is possible. I hope that we all benefit from this session. And again, I want to thank all of you who have done an effort to bring us together here and to learn from the countries and the panelists. Best in the session, and thanks so much, Stephanie.
Many, many thanks to both of our opening speakers for kind of setting the stage for the important conversations that we're going to be listening in on as we go forward. At this point, I'd like to welcome the co-authors of the multi-sectoral nutrition paper, who are going to share a brief overview of the framework and further inform the conversation that we're having. A couple of quick reminders as we head into that. Don't forget, if you haven't, to select the language down with your interpretation button on your screen, the language you'd like to be listening in on. And also, as we hear from our colleagues, please feel free to post questions in the chat. We have a team of folks monitoring the chat, and we'll do our best to respond and answer as possible. So with that, I'll hand the mic over to Julie.
Good morning, good afternoon, good evening. Thank you to everyone who's joining us today from all around the world for this exciting session. Today, as has been mentioned, we're taking the opportunity to kick it off with a brief presentation on a recently released World Bank discussion paper, which draws on early implementation experiences from 7 countries supported by the World Bank and the Global Financing Facility in operationalizing large-scale multi-sectoral nutrition programs that emphasize and strengthen governance. It's important to note that these countries are at relatively early stages of implementation, so the objective really was to document and synthesize the experiences in some of these countries, their challenges, opportunities from a nutrition governance lens, as opposed to focusing on impact at this stage. The countries that are included are Cambodia, the Democratic Republic of the Congo, Guatemala, Indonesia, Malawi, Nigeria, and Rwanda. While the multi-sectoral approach is conceptually appealing, we know that it's challenging to operationalize in practice. There's many common challenges that are discussed in the report. And just to give a flavor of some of them, for example, you have sustained leadership, limited capacity to implement and monitor strategies and programs at the subnational level, limitations in data availability, particularly that having to do with costing, financial tracking, and budgeting for multi-sectoral nutrition, lack of incentives to work across sectors, and general clarity about which combination of interventions and sectors can achieve the most significant impact. Oh, next slide, I'm sorry. The report draws on a desk review of current literature, project documents, and key informant interviews to synthesize and document 8 lessons that are aligned to a multi-sectoral nutrition governance framework, which is presented in the next slide. This framework is based on a 2018 systematic review that was done by Stuart Gillespie and colleagues, and you can see that it shows 8 dimensions that are considered as necessary and often interrelated to ensure strong multi-sectoral nutrition governance. We've adapted the framework slightly to add predictable and sustainable financing because we saw it as an important governance issue that has not been sufficiently addressed in the recent literature. We also subdivided the dimensions of the framework into the 3 broad categories that you see on the outer edge of the circle of the framework. Next slide. So with that, we'd like to engage our audience here for a minute, and we are going to be launching a poll, and we'd like to hear from you about your experiences related to this framework. We're using Zoom's polling feature to do this, so we'd like you to consider which of the 3 outer dimensions of multi-sectoral governance in your context have been the most challenging to address. These include advocacy, leadership, and institutional support for multi-sectoral nutrition, management capacity and financing, or C, results measurement, monitoring, and accountability. So you'll see a poll pop up, and just we'll give it a few minutes for people to put in their answers. Great, we have about half of the participants who have responded. We'll give it just a few more seconds. And Stephanie, remind me, do people see the responses or not yet?
As soon as you say close the poll,
Okay.
we'll enable that publishing.
Okay. Okay, I think we're slowing down. We're about 70% participation, so I think we can move ahead in the interest of time. Yeah. And we can see that it's almost a tie between advocacy, leadership, and institutional support, as well as management capacity and financing. I confess I'm a little bit surprised that results measurement, monitoring, and accountability didn't come up higher, but this is really interesting and a good way to read the room. So thank you everybody for your participation. Let's move on.
And you can just close your poll,
Yeah.
Julie.
Okay, great, thank you. Okay, so now we'll be diving into the framework, and we'll just be sharing very top level findings within each of these broad categories. We start with advocacy, leadership, and institutional support. for multisectoral nutrition. And within this, the first lesson is around the need for evidence-based advocacy for positioning nutrition improvement within a broader development agenda. We know this is critical for securing and sustaining political will and public support for a multisectoral nutrition agenda. We give two examples in Indonesia and Rwanda, where we know that quantitative evidence that tied stunting to the critical development agenda outcomes became an effective advocacy tool to obtain political buy-in. This is also related to high-level leadership vision and strategy for a whole-of-government approach. This includes not just the political will to engage in multisectoral governance, but also the commitment by high-level leadership to make institutional changes and strategic reforms that lead to new actions and potential financing commitments. Nigeria, Cambodia, Guatemala, Indonesia, and Rwanda have demonstrated that leadership at high levels like the president and vice president level have been critical to incentivizing collaboration across sectors and across levels of government, which is also related to the next lesson on the need for institutional and implementation arrangements that include coordination bodies that sit at high levels, for example, again, within the prime minister, president, or vice president's office, to support the operationalization of a multisectoral nutrition program. Later, you'll be hearing about Guatemala's institutional and implementation arrangements that promote the horizontal and vertical coordination that is needed to operationalize their multisectoral strategy. Next slide. The next category we look at is around management capacity and financing, beginning with the management capacity and accountability systems at the subnational level. For many countries, there's gaps in translating national multisectoral nutrition plans to the district level, which is where the implementation happens. So governments have to establish a coordinated approach to improve that subnational capacity to manage implementation from the district to the community level. In some countries included in this report, national nutrition program include results conferences and performance contracts, such as the annual district summit in Indonesia, Imihigo in Rwanda, and results-based financing in Malawi and Cambodia to ensure commitment and build management capacity and accountability at the subnational level. We also discuss the need to integrate multisectoral nutrition programming into regular planning and budgeting processes, which is needed to ensure that priority interventions identified in the nutrition plan are adequately financed and that funds are allocated efficiently. Some countries like Indonesia and Rwanda have undertaken public financial management reforms to institutionalize budget tagging, tracking, and evaluation to better capture nutrition spending across sectors and improve spending efficiency. Support from other ministries, enabling ministries like the Ministry of Finance or the Ministry of Planning are also critical to enabling these reforms. And finally, leveraging results-based financing to drive results. This has emerged as a promising approach to incentivize both the expansion of nutrition service coverage, as well as to address demand-side barriers through, for example, conditional cash transfers. In Cambodia, the results-based financing program, for example, is linked to improved quality and equity of nutrition services delivered through the health sector. And in Rwanda, the results-based financing program is aligned to among service providers, communities, and households, and then coordinated geographically to promote a convergence approach. You will be hearing later about how the Indonesian government strengthened the management capacity and accountability systems at the subnational level to help implement, monitor, and finance their multisectoral nutrition strategy. Now, next slide. With that, I will be handing it over to another one of the co-authors, Ali Subandoro, to close out the presentation. Thank you.
Thank you. Thanks very much, Julie. So I'll go to the next slide. We'll be discussing on results measurement, monitoring, and accountability. So the report discussed lessons learned on strengthening performance monitoring system and promoting the use of data. So we know that having quality and timely nutrition data and robust monitoring system is key to enhancing program implementation, enabling course correction, and strengthening the accountability. So the report highlights country experience in investing in interactive and also interoperable monitoring system that can routinely collect key nutrition data and track the convergence of priorities surface. The report also discussed how the country used this data for improving implementation. So you will later hear about the steps that the Rwanda has taken to establish an integrated performance monitoring system. Rwanda has also rolled out a very innovative PFM, public financial management reform, to improve the tracking of financial resources. So the next lessons learned is on the citizen engagement, community mobilization, and social accountability. So these are all very critical to encourage local participation in setting nutrition goals and demanding accountability for quality service. The community-based engagement model should be part of the national multi-sectoral nutrition strategy and its coordination platform. Countries like Cambodia, Indonesia, and Rwanda, for example, use scorecards to monitor surface utilization, as well as to trigger actions to improve service gaps at the community level. Countries like DRC, Nigeria, and Cambodia also implement a very basically has implement the SBCC program to raise awareness among families about malnutrition and its impact on child development, which have been helping to ensure sustained demand and access to service through community mobilization. So we will later hear more detail from the Cambodia experience in developing a scorecard for district to measure indicators at the community level. So the report, we ended the report with a looking ahead section that focused on continued need for investment in data quality and data system enhancing the use of data. High quality data are the foundation for better understanding of the impact of governance approach on delivery and quality services. So the investment in improving monitoring and evaluation include implementation research on key programmatic areas such as budget performance evaluation, subnational level implementation, and entry points for convergence. We also need to do more evaluations on efforts to enhance the quality of service and mix of interventions for convergence. So with that, we hope that you find this report useful, and I will turn it back to Stephanie to introduce our country speakers. Thank you.
Thanks so much, Ali and Julie. And as both of you have indicated, we're now moving into hearing that kind of real country experiences. We are featuring 4 of our colleagues here in the mix, and I'm gonna take them one by one and just remind all of our participants in this session to continue to point out any observations or questions in the chat box. We've had some great activity already. And again, be sure you're in your language interpretation channel, as we have some different languages represented during these presentations. So first up, it's my pleasure to welcome Ms. Lizette Guzman, who is the Secretary of the Secretariat for Food Security and Nutrition from the government of Guatemala. So handing the mic over to you.
Muy buenos días a todos, buenos días audiencia. Para nosotros es un honor poder ser parte de los 7 países, ¿verdad? Que tenemos la oportunidad de hoy compartir la experiencia. Nos sentimos muy honrados. Yo quisiera iniciar contando la estructura orgánica de nuestro Sistema Nacional de Seguridad Alimentaria y Nutricional, en donde este se encuentra conformado por una plataforma de un Consejo Nacional de Seguridad Alimentaria y Nutricional, que esta es nuestra plataforma al más alto nivel, ¿verdad? Es decir, acá la preside el señor vicepresidente y su servidora como la secretaria de Seguridad Alimentaria y Nutricional. Esta se encuentra conformada por 17, ¿verdad?, instituciones, las cuales ustedes pueden ver a su mano izquierda, ¿verdad? Como les repetía, ¿verdad? La vicepresidencia es el máximo nivel, ¿verdad?, de los que coordinan en este espacio. Luego, su servidora, quien es la que se lleva el secretariado, ¿verdad?, del espacio. Luego, la cooperación internacional a través de los grupos de instituciones de apoyo y la instancia de participación social, INCOPAS. Esta se encuentra conformada por la sociedad civil. Tenemos 5 espacios que lo representan, ¿verdad? Entonces ellos ahí pues presentan sus comentarios, sus aportes, lo cual ha sido muy enriquecedor para nosotros. La experiencia de Guatemala es bien interesante porque a partir del 2005 nosotros contamos con una ley, una política y un reglamento. Esto nos permite la plataforma ideal, ¿verdad?, para una coordinación y articulación y abogacía. Nosotros, contar la experiencia de abogacía es que en el 2010, derivado de esta plataforma, somos parte o nos hacemos parte del movimiento SON, Scaling Up Nutrition. Y es así como el secretariado nos toma en cuenta, ¿verdad?, para hacer las evaluaciones anuales. Este año, pues no fue la excepción. Recibimos una felicitación del secretariado por ser uno de los únicos países de poder darle continuidad a esas evaluaciones anuales, y somos un ejemplo para Centroamérica por la estructura de gobernanza que tenemos. Siguiente. Como les explicaba en la anterior diapositiva, nosotros contamos con un Consejo Nacional de Seguridad Alimentaria y Nutricional, pero esto debe bajar en efecto cascada a nuestras comunidades. ¿Y cómo lo hacemos? Existe una comisión, ¿verdad?, municipal de seguridad alimentaria en cada uno de nuestros municipios. En Guatemala nosotros contamos con 340 municipios. De estos 340, 333 cuentan con una comisión municipal de seguridad alimentaria y nutricional. De la mano derecha, ¿verdad?, ustedes pueden ver esos departamentos que se encuentran remarcados, en los cuales están aún en proceso de conformación de su comisión municipal. Y esto ha sido, en algunos casos, ¿verdad?, están en construcción, y en otros ha tenido mucho que ver la voluntad política de las autoridades en las regiones. Entonces es como ustedes ven en el mapa, ¿verdad?, que estos 3 departamentos que se encuentran en café son los únicos que de las 7 comisiones municipales que no están listas aún. Siguiente. Bueno, este es nuestro recorrido y nuestra línea del tiempo como país, en la cual, pues, en el 2006, derivado de la ley, ¿verdad?, que nace en nuestro país, arrancamos con un programa de reducción de la desnutrición crónica. Luego, en 2008, avanzamos con una estrategia de reducción de la desnutrición crónica, y en 2012 es conocido por ustedes el Pacto Hambre Cero. En el 2012 inicia una evaluación de impacto, que es por la accountability que ustedes hablaban, ¿verdad? Y luego en el 2016 tenemos una estrategia también de reducción de la desnutrición crónica. Para el gobierno en gestión, nosotros lanzamos como estrategia la Gran Cruzada Nacional por la Nutrición. Esta, a diferencia de las demás estrategias, cuenta con una línea basal que está ahorita en construcción. Esperamos tener en 3 meses resultados de la misma. Ya les abordaré un poco más respecto al tema. Siguiente, por favor. En este slide ustedes pueden ver cómo se encuentra conformada la Gran Cruzada Nacional por la Nutrición. Y es que se hizo una priorización geográfica de 114 municipios. Estos 114 reflejan los índices más altos de desnutrición crónica. Es por ello que forman parte de esta estrategia de atención. Esta estrategia tiene 5 líneas de acción, ¿verdad? Pero entre sus prioridades, pues, se encuentra la prevención de la desnutrición crónica y anemia, la reducción de la morbilidad y mortalidad materna infantil, la promoción de la seguridad alimentaria y nutricional en la población guatemalteca. Hemos visto con mucha necesidad el fortalecimiento a los sistemas de salud, ¿verdad?, el primer nivel de atención, así como prevenir las enfermedades infecciosas y crónicas. Siguiente, por favor. A continuación, ustedes pueden ver la metodología de evaluación de impacto que nosotros estamos utilizando para la Gran Cruzada. Y es que tenemos, la meta es la visita a 15,000 hogares. De estos, actualmente nosotros hemos llegado a 12,000 hogares. tuvimos ciertos desafíos por el tema de la pandemia, en el cual nuestros encuestadores pues tuvieron COVID y fuimos ahí como nos fuimos un poquito retrasando un mes, pero esperamos en el mes de marzo poder tener estos resultados. Se dividieron por 3 estratos, lo cual nos parece muy interesante, y es municipios priorizados por la Gran Cruzada, municipios en donde la cooperación internacional está intensificando esfuerzos, y municipios control, que le llamamos, que son los que no son parte de la estrategia de la Gran Cruzada. Siguiente.
And just a friendly reminder about if you could wrap up in 1 minute, please. Thank you.
Y es acá como ustedes pueden ver cómo se conforma la evaluación de impacto. Nuestros 15.870 hogares, que es la meta, ¿verdad? 529 sectores cartográficos y 6.798 niñas y niñas que conformen los 15.000 hogares. Siguiente. Bueno, ¿y cuáles son nuestros desafíos y nuestras próximas etapas? Nosotros como gobierno vemos con buenos ojos poder fortalecer el trabajo interinstitucional de cada uno de los sectores. Es decir, si bien llevamos una coordinación actualmente, la podemos llevar a otro nivel. También incrementar la cobertura efectiva de los programas institucionales, fortalecer la gestión de resultados, incrementar la participación activa de las municipalidades para que en el slide donde ustedes vieron que teníamos 7 comisiones municipales pendientes aún para completar todo el país con esa cobertura de gobernanza, podamos llegar a su totalidad. Finalizar la actualización de la política. Comentarles que nosotros nos encontramos actualmente en un proceso de actualización de la política porque la seguridad alimentaria y nutricional desde 2005 a la fecha ha cambiado. Y es por eso que nosotros, en un ejercicio de abajo hacia arriba, de un ejercicio en donde nace de nuestras necesidades, de nuestras poblaciones, las necesidades, hemos considerado nuevas vertientes de la seguridad alimentaria y nutricional. Así que será de mucho agrado poderles compartir esa política nueva que vamos a tener, que ya está adaptada a ese cambio climático, a esas necesidades que como país hemos evolucionado. Muchísimas gracias.
Many, many thanks to Ms. Guzman for the Guatemala presentation. And again, we're a little bit behind in this session, so that's why I'm trying to monitor that we're staying on time, so appreciation for that. And so with no further ado, I'm gonna introduce our next speaker from Indonesia, Mr. Budiano Subambang, who is the Director of Regional Development at the Ministry of Home Affairs with the Government of Indonesia. Over to you.
Okay, good morning, ladies and gentlemen. Ya, selamat pagi. May you all be healthy and well. First, please allow me to introduce myself. My name is Budiono Subambang. I serve in the Ministry of Home Affairs as a Director of Synchronization of Regional Development Affairs. Then, let me speak in Bahasa Indonesia to share our experiences in managing capacity building at the subnational level to improve the convergence of nutrition intervention toward stunting reduction. Next slide. Apa yang akan saya kemukakan berawal dari keyakinan pemerintah Indonesia bahwa pendekatan konvergensi intervensi gizi adalah pendekatan yang tepat bagi upaya penurunan prevalensi stunting. Untuk menerapkannya, pendekatan konvergensi memerlukan integrasi lintas sektor sejak tahap perencanaan, penganggaran, hingga pemantauan hasil untuk memastikan intervensi tersedia dan berkualitas bagi kelompok sasaran prioritas, yaitu rumah tangga 1000 hari pertama kehidupan. Namun dengan sistem desentralisasi di Indonesia, pendekatan konvergensi juga memerlukan koordinasi vertikal yang melibatkan pemerintah pusat, pemerintah provinsi, pemerintah kabupaten kota, dan desa. Mengingat kabupaten kota adalah penanggung jawab utama penyediaan intervensi gizi, sementara angka stunting dan kapasitas pemerintah kabupaten atau kota dalam mengkonvergensikan intervensi gizi sangat bervariasi, maka penguatan konvergensi di tingkat kabupaten atau kota menjadi fokus peningkatan kapasitas. Penguatan konvergensi di tingkat kabupaten atau kota selanjutnya telah menjadi bagian dari 3 pilar strategi nasional percepatan pencegahan atau penurunan stunting. Pada pilar 3 ini, kami Kementerian Dalam Negeri berperan dalam memperkuat kapasitas pemerintah daerah untuk mengkonvergensikan program dan kegiatan yang didanai pemerintah pusat, pemerintah daerah, kabupaten kota, dan pemerintah desa. Next slide, please. Dalam pengembangan kapasitas pemerintah daerah, kami menggunakan 3 instrumen yang saling berkaitan, yaitu 8 aksi konvergensi, penilaian kinerja kabupaten atau kota, dan technical assistance pool. 8 aksi konvergensi digunakan kabupaten atau kota untuk meningkatkan efektivitas perencanaan, penganggaran, dan penargetan intervensi berbasis bukti. Penilaian kinerja digunakan provinsi untuk memperkuat akuntabilitas, penggunaan umpan balik, dan untuk menyediakan perbandingan kinerja antar kabupaten atau kota dalam perbaikan konvergensi intervensi gizi. Instrumen ini sangat sejalan dengan penguatan peran provinsi dalam pembinaan dan pengawasan kinerja kabupaten atau kota. Technical Assistance Pool dikelola oleh Kementerian Dalam Negeri untuk menyediakan dukungan implementasi pengembangan kapasitas dan membangun kapasitas provinsi dan kabupaten kota. Sasaran pengembangan kapasitas ini adalah kabupaten atau kota melalui penguatan peran provinsi, sehingga model pengembangan kapasitas yang kami terapkan bertujuan meningkatkan kapasitas provinsi, melakukan pembinaan, pemantauan, dan evaluasi terhadap kabupaten atau kota agar kabupaten atau kota semakin mampu dalam meningkatkan konvergensi program. Untuk menjalankan peran pengembangan kapasitas ini, kami memobilisasi technical assistant dengan wilayah kerja berbasis regional. Jadi bukan berbasis provinsi atau kabupaten atau kota. Bantuan technical assistant dilaksanakan dengan pendekatan sebagai berikut. Pertama, agenda bantuan teknis disusun merespon kebutuhan kabupaten atau kota. Jadi berdasarkan permintaan kabupaten atau kota atau berdasarkan penilaian kebutuhan oleh provinsi. Kedua, bantuan teknis memperkuat praktek penggunaan data dan informasi bagi proses pengambilan keputusan. Ketiga, bantuan teknis mendorong keterlibatan dan koordinasi lintas sektor. Keempat, bantuan teknis memperkuat sistem yang berlaku, tidak menciptakan sistem atau mekanisme yang bersifat ad hoc. Next slide, please. Berikut adalah ruang lingkup Technical Assistance Pool, meliputi satu adalah advokasi untuk memperkuat komitmen pemerintah daerah dalam upaya percepatan pencegahan atau penurunan stunting. Yang B adalah melatih tim stunting daerah untuk melaksanakan dan memanfaatkan hasil aksi konvergensi. Yang C adalah mendokumentasikan praktek-praktek baik dan fasilitasi pembelajaran antar daerah. Yang D, mengidentifikasi kebutuhan peningkatan kapasitas sektoral dan menghubungkannya dengan narasumber yang relevan. Yang E, mengembangkan panduan atau bahan pelatihan. Yang berikutnya F, mengembangkan platform dan media pembelajaran online untuk memaksimalkan jangkauan pengembangan kapasitas. Pada diagram, Bapak dan Ibu dapat melihat bahwa counterpart kami di provinsi dan di kabupaten atau kota adalah Bapeda, Badan Perencanaan Pembangunan Daerah, yaitu perangkat daerah yang bertugas mengkoordinir dinas teknis atau sektoral dalam perencanaan, penganggaran, dan pemantauan program. Bantuan teknis, technical assistance,
1 minute left, please.
pada stunting provinsi dan kabupaten kota dikoordinir oleh Bapeda masing-masing. Selanjutnya pool terdiri dari TL pusat, regional. Nah, pada slide berikut akan kami tampilkan komposisi tenaga ahli technical assistant pusat dan daerah. Next slide. Komposisi tenaga ahli mempertimbangkan kebutuhan konvergensi intervensi gizi sejak tahap perencanaan, penganggaran, dan pemantauan hasil pelaksanaan program. Komposisi dirancang untuk memperkuat advokasi dan kualitas tahapan tersebut dengan penggunaan data dan informasi yang lebih berkualitas. Next slide, please. Sejak kami memobilisasi Technical Assistance Pool pada tahun 2018, sejumlah perbaikan yang diharapkan dapat dicapai, namun tantangan juga masih ada. Dengan model pengembangan kapasitas ini, bantuan teknis Technical Assistance Pool dapat menjangkau seluruh provinsi, kabupaten, atau kota. Kerjasama lintas sektor membaik dan kesadaran pemerintah daerah terhadap pentingnya data yang berkualitas juga meningkat. Begitupun koordinasi lintas kementerian, lembaga di pusat, antara lain dalam hal manajemen data masih perlu diperkuat untuk mendukung upaya konvergensi di tingkat kabupaten atau kota. Demikian kami sampaikan, terima kasih.
Indeed, and thank you so much for that really rich presentation. Yes, indeed. And in the interest of time, I'm just going to move us right along. I see a couple of great questions in the chat box. We'll do our best to respond to those. But with no further ado, let me move on to our next speaker, who will be coming to us from Rwanda, Mr. Gilbert Munyamana, who is the Deputy Director General of the National Child Development Agency. Over to you.
Yeah, thank you very much, Stephanie. Thank you, everyone. As Stephanie already mentioned, Gilbert, I work for the National Child Development Agency, an agency that has the mandate to coordinate all the activities related to early childhood development, child protection, and specifically fighting malnutrition in the country. Please go to the next slide. Yes, and today I'm going to talk about strengthening performance monitoring system and promoting the use of data to improve the multi-sectoral nutrition program implementation. As I already mentioned, NCDA, National Child Development Agency, which sits under the Ministry of Gender and Family Promotion, is coordinating, is having a multi-sectoral approach, which brings together different institutions and mainly 7 ministries, and the activities related to children are coordinated by our agency. Next slide, please. Yeah, over the last 20 years, Rwanda have made remarkable progress, mainly in maternal and child health, reducing poverty levels, increasing agricultural production, and the environmental health. And this was mainly due to the strong and high level commitment, which have been accelerating all those progress, including the reduction of stunting in the country, as you can see on the graph that we are having here, how it have been going down during the years. But also because apart from the commitment which have been made, actually the commitment which are at the government level from His Excellency President Kagame and all the local governments in the last summit. Nutrition for Growth, Rwanda have made a commitment to reducing also this nutrition rate to 10% in 2030. So you can see that we are in 2033, we have to double the efforts. And some of the tools which are helping us, it's also the monitoring system and the way we're using data are the key drivers to also accelerate the reduction of stunting, as we're going to see. And also the availability of this quality of data in multi-sectoral nutrition program is very critical to help us in decision making, but also making sure that we're improving in accountability. So going to the next slide. And we have first the Ecd Dashboard. The Ecd Dashboard, it's an initiative that we have introduced in collaboration with GFF and other partners in making sure that we are tracking the progress and data-driven decisions. So this one, the Ecd Dashboard, it brings together all the data from different areas. As I mentioned, from health, the health information management system, and then it integrates the Ecd data, but also the data from different ministries which are related to children. So in that dashboard, you can have this easy visualization, the key performance indicators, and to see where to put more effort, because this is disaggregated up to the lowest administrative level in the country, which are the villages. And it was mentioned before, we have also introduced the Child Scorecard. This is a card which has 222 priority nutrition services. These have different indicators from pregnancy, actually, and up to 2 years, because this is where, this is a card. I'm going to show you the screenshot or how it looks like. And then the community health workers will always be monitoring those indicators, and from the village level to the nutrition to the sector level up to still it goes to the integrated system, to the Ecd Dashboard, which will give us the issue which you can see in different areas and also take decision. The interoperability across data systems. We have different systems. On the picture here, you can see a picture of 2 parents who are registering their kids in the system, the civil registration and vital statistics system. This is very helpful because also on targeting the beneficiaries of different projects, it's really easy to extract those different data. For example, on this project of nutrition sensitive program that we are having in Rwanda, it has been really easy to select different beneficiaries. And if we go to the next slide, please, next slide. Yes, on the next slide, you can see this is the scorecard. So in the scorecard, I have made a bigger picture to show the environment and WASH indicators, household has toilets, household has clean drinking water. All these are the indicators that comes together, and then the sector, the local leaders will see what is the problem that may be causing the malnutrition in that area. And this is the screenshot of the dashboard, where you can see the number of ECDs and then the number of children enrolled and so on and so on. So this is the picture that I've already shown before. And if we go to the next slide, which is going to be my last slide, it's more on improving the nutrition resource tracking to improve the efficiency of spending. We normally have the integrated financial management information system, where all the financing or the budgets of the governments are integrated in. But now we have introduced the nutrition budget tagging and tracking system. This comes first as a ministerial instruction and budget circular note to all CBMs. CBMs are chief budget managers, to always be tagging the nutrition activities. This morning, we have been reviewing the annex that have been sent. And you could see that many areas, if we talk about the Ministry of Environment, we have to see they're looking at the tea plantation, but how many tea fruit trees are going to be planted. So having that sensitivity on nutrition, it's something that is going to be helping us as an ongoing exercise. And also it's going to be helping in regular monitoring on financial data to see how much are being invested, and also comparing it with the performance of different projects. So in the nutshell, this is what I prepared today to share with you. And in 5 minutes, you cannot go in all the details, but I believe that in the report, some more details are there, and then during the discussion. So thank you very much. Over to you.
Many thanks, Gilbert. And yes, we are going through these country experiences with just a bit of a thumbnail. And so moving us along, it's my pleasure to now introduce Mr. Shea Pala, who is the Director of Policy Analysis and Development Division and Cambodia Nutrition Project Manager of the National Committee for Subnational Democratic Development Secretariat of the Royal Government of Cambodia. Over to you, Mr. Pala.
Yep, thank you very much, and good morning and good evening, everyone. First of all, I would like to thank for allowing me to share with you the presentation on community engagement and social accountability, important contributor to improve nutrition outcome. As you know, community engagement and social accountability is important in a fair, equitable, and democratic society. Like other democratic countries, the right to freedom of civic engagement and the right to demand for accountability has been enshrined in the Cambodian constitution and guaranteed in law, legislation, working procedure at both national and subnational level. Next slide, please. All subnational At subnational level, there are several civic engagement mechanisms being take place. For like community council are elected directly by citizens, while capital, provincial, municipal, district, and council are elected by community councillors. This means that Cambodian people are allowed to freely participate in the selection of their representatives at local level. To perform their representative function, a subnational council obligates to organize monthly meetings publicly to allow citizens to participate. The council also obligates to regularly conduct public consultation, forum, dissemination, to disseminate, consult, and receive feedback and comment from citizens. And within the council planning process, there are several steps that requires the participation of villagers, interested groups, and community representatives to identify the issue, priority, and local need to be included in their development plan and investment program. Besides participating in the planning process, citizens are also encouraged to participate in project implementation as well as monitoring, evaluation of the effectiveness of the project. Ombudsman has been set up attached to each subnational administration to be responsible for handling a complaint of citizens in regards to their service delivery and all administrative management issue. Another important mechanism is the social accountability framework, which designed and being implemented at district and commune level to improve transparency, access to information, and promote citizen-led monitoring on the performance of local administration. Next, please. And the Cambodian nutrition projects integrate many of these principal mechanisms and procedures into the project. Under Cambodian Nutrition Project, CNP, the community engagement is essential to encourage local participation in setting nutrition goals, demand for accountability for quality service through community scorecard, address knowledge and behavior and cultural barriers to malnutrition through social behavior change communication. And the community level actors have to improve local advocacy and awareness raising, provision of nutrition-related information, services, and referral. Mobilization of constructive feedback on service and participation in planning and resource allocation. Next, please. In CNP, the NCD implement community-based intervention in 7 priority provinces in order to stimulate demand, increase utilization of facility-based priority service, and encourage adoption of improved reproductive, maternal, newborn, child, and adolescent health and nutrition behavior. Specifically, CNP's component 2, that is implemented by NTD aims to strengthen the link between the subnational administration, public health provider, and the citizen, create demand for increased access to priority health and nutrition service, strengthen public sector commitment and accountability to improve availability and quality of priority health and nutrition service, and use the performance-based grants to improve subnational administration service delivery and sustainable financing of relevant social service activity linked with CNP priority services. Next, please. CNP also improve the community service quality through the performance-based financing, in which the commune program for women and children, CPWC, is the community platform for health and nutrition promotion. Village Health Support Group, VHG, are the frontline implementers of a package of activities aimed at facilitating community access to health, nutrition information, and increasing utilization of health nutrition service among households. And various forms of financing to commune are utilized to enable them to implement the CPWC. One of these is the commune service delivery grant, which is a performance-based financing scheme aimed at improving service delivery and strengthening accountability among service providers at the subnational level. Routine performance assessment of commune are made using a community scorecard that measures input, process, and also outcome related to the multi-sectoral nutrition intervention. Next, please. Community is engaged and play an active role in strengthening both access and the quality of the service provision. As a part of CPWC implementation, community chief sought ensures participation from an engagement with citizens and community, especially women, children, and indigenous people through discussion to identify the problem and need. TPWC activity planning, TPWC activity implementation, evaluation of VHG performance, and provision of feedback, complaint on TPWC service delivery by health center, VHG performance, and as well as respond to such feedback. And these elements of community engagement is also made explicit in the community service delivery grant routine assessment to make sure that it is carried out properly. Thank you very much for your attention.
Many thanks, Mr. Paula, and to all of our wonderful and engaging country experience speakers. And now, in the interest of time, we want to broaden out the perspectives we're hearing about and shift to another key stakeholder group in the world of multi-sectoral nutrition. And I'm going to invite our colleague, Leslie Elder of the GFF, to introduce and moderate a panel of partners.
Thank you so much, Stephanie. It's great to have everyone here, and thank you, country participants. Those were incredibly effective presentations. As Stephanie said, we're going to turn now to a group of very important stakeholders and development partners for multi-sectoral nutrition programming. It's my pleasure to introduce first Sean Baker, Chief Nutritionist at USAID. Next, Laura Rawlings, a lead economist at the World Bank Group. And finally, Grania Moloney, Senior Nutrition Advisor at UNICEF Headquarters, New York. I will propose a question to each of you, and we really want to get a sense from your agency, from your perspective, how governance has played an incredibly important role in multi-sectoral programming for nutrition. So Sean, over to you. In addition to the USAID 2014 to 2025 multi-sectoral nutrition strategy, you, under your leadership, you've had USAID elevate nutrition to an all-of-agency priority, which brings together a variety of funding streams and approaches across the agency, putting nutrition at the center. So how will this approach help USAID to more directly assist countries to strengthen their nutrition governance capacity and effectively deliver multi-sectoral nutrition programming? Thanks, over to you.
Thanks so much, Leslie, and thanks for inviting me to this panel, and thanks particularly to starting out with these incredibly inspiring country presentations, because anything we do at the global level, if it's not translating into better impacts on the ground, it's for naught, right? And to step back a bit, and I was smiling when Julie presented it, that the multi-sectoral approach is really appealing, but then the hard work of actually making it happen hits you. And it, as we can see, you know, there's a lot of detail there that you need to get right. And as you'd stated, USAID adopted a multi-sectoral nutrition strategy back in 2014. And I think it's a very robust strategy, but we didn't necessarily have the architecture in place to make it work. And that has been part of my role over the last 2 years. And in many ways, modeling the behavior that we as donors are often encouraging our partner governments to take, but we're not necessarily taking it within our own shop. And within USAID, we have nutrition funding cuts across 3 major pillar bureaus in Washington: the humanitarian assistance, global health, and then resilience and food security. So nutrition in humanitarian settings, nutrition through the health system, and nutrition through the food system. But we've had a very robust nutrition technical working group that looks at the nutrition experts across those 3 pillar bureaus, but that was further elevated to have a nutrition leadership council that takes the senior managers from the pillar bureaus, as well as the regional bureaus, which very importantly supervise our missions on the ground. And then my day job is, how do you make this work together? Now, is this working? Now, we've not done a robust evaluation yet, but I would say there are positive signals, starting with, as soon as this position got put into place, we were hit the pandemic, and it was an agency we were able to come out with all of USAID guidance on nutrition in the context of COVID-19 and hold multiple webinars externally and internally to try to, how do we elevate this and make sure we're responding as an olive agency, not in a piecemeal fashion. I would also say, as we went into this last year of refreshing the global food security strategy, which underpins Feed the Future, you will notice there's a very strong elevation of safe, affordable, nutritious food systems, et cetera. Also, USAID has led across the US government the Global Nutrition Coordination Plan, which was signed by 3 secretaries at the cabinet level, our administrator, et cetera. And I think that culminated in our ability to lead the US government when our administrator Power went to Tokyo virtually to lead the US government commitments at Nutrition for Growth. So I think these are signs that this improved internal coordination is helping us to elevate nutrition as a priority across the agency. And now we get to the proof of the pudding. How would this translate into supporting our partners on the ground better to do better work? Now, I find that one of the strongest parts of USAID is the fact that we're such a country-facing organization. And so we have missions on the ground in the countries where it matters. And to me, it was a thrilling part of Nutrition for Growth that we had very high-level commitments from 45 low and middle-income countries. And in what sort of a replenishment moment in the past have we seen that level of country-level leadership, which I think is truly transformational? Now, one of our major priorities as we go into this year is the financing agenda, and working very strongly as part of our contribution to the Scaling Up Nutrition movement in partnership with USAID Advancing Nutrition, the Bill and Melinda Gates Foundation, of how do we get better tools and methods to our partners on the ground to really set up the financing plans that are needed to be able to fund nutrition to the level it's required. And we're really excited about some of that work and how it will better contribute. Another thing I think we're very proud of are some of our commitments we've made to continue our push to improve data systems, because at the end of the day, if we're not understanding how our key nutrition service is being delivered through the health system, how is the food system delivering on key nutrition outcomes, then nobody, be it our partner governments, their partners, we as donors who are supporting, can really continue to prioritize and drive. And perhaps that would be my final point, is that I think there sometimes is a confusion of multi-sectoral nutrition programming is a kitchen sink approach. In fact, it's not. It's actually being extremely clear exactly what are the priorities. In fact, if anything, it requires even more prioritization, because it requires prioritization in the health sector, prioritization in the food system, prioritization in social protection. And it's really, you need that data to say, okay, in a given setting, what are going to be the highest impact actions in a given sector? How do you get the resources to that sector? And then how do you hold that sector accountable? And so we need to make sure that multi-sectoral nutrition programming is not perceived as a just throw it all at the wall approach and maybe pray that something will happen, but it's a very evidence-based, strategic, prioritized approach. Over to you, Leslie.
Thanks, Sean. That really, and I'm hearing a lot of resonance with what the countries told us that they're working on, including course correction based on evidence and convergence and institutional convergence in the case of USAID. So thanks so much. Laura, I'm going to turn to you now. The World Bank often takes a multi-sectoral approach to the broad topic of human capital development and addressing nutrition, particularly during the early years of life. So my question to you is, how is the World Bank elevating and addressing some of the issues of nutrition governance that we have heard about this morning? Over to you.
Thanks so much, Leslie, and the team for the invitation to participate today. I wanted to just start by offering my congratulations to Ali, Julie, Sylvia, and the team of authors who've developed this paper that was presented. I think it's extremely useful. It was also very well complemented by the country examples we heard from this morning. And I think this is essential because it's important to not only know what to do, but essentially how to do it. And that's really what governance focuses on. So Leslie, over to your question. I want to just touch on a few areas where the World Bank, and not only the World Bank, but development partners, and very importantly, the governments that we support and other actors, how we are engaged and how we use our analytical and operational work to really highlight these governance issues with respect to nutrition in a child's earliest years. And in reflecting on this, I thought it would be useful to distinguish between 3 levels of engagement: a policy level, a program level, and the service delivery level. So I'm just going to highlight a few elements in each of these areas that I think are really important tools and pathways for supporting governance. And we actually heard a lot about these already in the country examples. So starting at the policy level, we often use theories of change that provide an overview of the investments needed to achieve desired outcomes in nutrition and child development. And these frameworks are extremely useful because they outline the contributions of various sectors for achieving these outcomes. And they are really central, I would argue, to framing complex multi-sectoral agendas such as nutrition. Another element at the policy level is that we rely a great deal on evidence to inform policy. So evidence and data from population level surveys to provide insights into achievements and gaps, budget data for an overview of available resources and their allocation, and impact evaluations to examine what works and what doesn't. Turning next to the program level, we are increasingly focused on supporting governments to design and coordinate across programs to really achieve the synergies that we know are needed to achieve robust nutrition and development outcomes. So what are some of the approaches at the program level? First, we increasingly see complements between demand-side programs that support families, such as cash transfers or parenting programs, coupled in a very intentional way with supply-side programs that provide nutrition-specific or nutrition-sensitive services, such as primary health care and water and sanitation services. Second, at the program level, we see a lot of emphasis on supporting management structures that allow for this coordination across programs. Every single one of the country examples spoke about this, but it's really important to have these management structures to ensure that families and children have access to the multiple drivers of strong nutrition and child development outcomes. Ali and I are peer reviewers right now for a new program in a country that's just being launched, where they've determined that only 5% of young children have access to an adequate diet, exclusive breastfeeding, clean water, and basic health care. So this kind of convergence is essential. And let me conclude by talking about the service delivery level. I think often this is actually one of the most challenging areas on which to work, and an area that I would argue needs quite a bit of additional support. So this is really the nuts and bolts area that calls on governance issues. So let me just highlight 3 things very quickly there. The first, as many panelists have already mentioned, is the importance of monitoring and accountability. This is in the framework that's provided in the paper, and I'm delighted that it's there. But we know that service providers need to be accountable to policymakers and, very importantly, to the communities that they serve. So we need effective performance management systems that rely on current monitoring data linked to clear responsibilities so that responses can be made. So a good example of this was what the Indonesians presented about their actions, their district performance assessments, and their technical assistance. But these performance management systems are central. Second is the importance of having structures that ensure effective coordination at the central, subnational, and local levels. So this is based on a very clear understanding of each one's capacities, roles, and responsibilities. What are the results that each group is responsible for? And interestingly, this often calls upon mobilizing actors outside of the public sector, right? To perform key roles and to find effective ways to coordinate with them and support them. And I was really happy to hear that Cambodia's whole system here is really strengthened on set on mobilizing communities. And also Guatemala spoke a lot about the role of civil society organizations. And last but certainly not least, I would highlight the focus on results. Structures such as results-based financing or results-oriented medium-term expenditure frameworks can help set incentives for reaching desired outcomes. And here, I think we heard a very good example from Rwanda about how they link their financing data and IFMIS with the performance monitoring data that they have for nutrition and child development outputs and outcomes. Thank you so much for the opportunity to share these thoughts.
Thanks, Laura. Very clear and really, really helpful diagnosis along the 3 levels. So Granye, I'm going to turn to you now. UNICEF has championed improved child nutrition for decades, and it has taken a multi-sectoral approach beginning with the 1990 UNICEF conceptual framework of malnutrition. Does today's discussion of the importance of a governance lens within multi-sectoral nutrition programming resonate with your experience of nutrition programming? And how does UNICEF contribute to strengthen nutrition governance at the country level? Thanks.
Thank you so much, Leslie, and thank you so much. What a fantastic webinar and a great way to kick off the new year, listening to these very inspiring country examples. So yes, indeed, we did create the first framework in the 90s, and you may have seen that we have a new framework that was released before Christmas which is reflected in our new 10-year strategy, and that really emphasizes the multiple system approach to address nutrition, that it's no longer just a health system issue, and that there are many different players and sectors that play a role. So I'm going to talk about 3, I'll give some practical examples of 3 particular areas of governance. One is on financing. In recent years, particularly in partnership with FCDO, UNICEF has worked on innovative approaches to financing supplies, specifically ready-to-use therapeutic food for the treatment of severe acute malnutrition. And that's through the development of an RUTF match fund that's managed by our supply division, and that allows governments who are ready to put in their own domestic resources to then benefit from some match funding from other donor governments. And so far we're seeing great success already. Nigeria, Senegal, Uganda and Mauritania have leveraged domestic resources and have benefited from that in 2021. And we have a whole number of countries lined up for 2022. In fact, the fund is more successful and we need a lot more money. And thankfully, new partners are stepping up, including the Children's Investment Fund Foundation and the Gates Foundation. So we are excited that this will be a new way of really sustainable financing for crucial supplies for children, particularly outside of emergency contexts. Another example on financing is the Vaccine Independent Initiative, which is not just for vaccines, but it's fundamentally bridge financing for commodities. And again, in recent years, we've been using that bridge financing for RUTF. So governments that may not have had their budgets approved, are waiting for some cash flow, can actually benefit from this bridge financing and procure commodities such as RUTF. So again, we have a few countries who have benefited from that mechanism, and we hope to scale that up going forward. For example, last year, Ethiopia was supported with this pre-financing. And then important, when we talk about multi-system approach, many of you will be aware of the Global Action Plan on Wasting that was commissioned by the Secretary General a few years ago. And we were so proud of the 23 country action plans that were launched at Nutrition for Growth. And UNICEF, with its sister UN agencies, WHO, FAO, UNHCR, WFP, really worked closely with governments on detailed costed plans so that the governments are prioritizing what they want to invest in to prevent wasting, to ensure early identification and treatment for young children. So really that kind of very micro planning on how much will this cost, what do you want to prioritize, where will you seek the funding for? So we have all of those costed plans up on our website, childwasting.org. So please have a look in there, and very impressive work by 23 countries going forward. The second area I want to touch on is on data and accountability. And first to say that UNICEF with the Gates Foundation, USAID and WHO, in fact, submitted a joint commitment on data through Nutrition for Growth to improve the availability, use and build the capacity of national systems on data. So we really are committed to coming together and investing in this. Obviously, data is core to our work. We hold the Global Infant and Child Feeding Database, which actually has data for 90% of the world's children who are under 2, and which was a core resource for our Fed to Fail report, which included a recommendation on strengthening public accountability for young children's diets by setting targets, tracking progress through sector-specific monitoring system and household surveys. UNICEF obviously supports household surveys such as MIX, but more recently, and well, not even recently, maybe in the last 10 years, an increased focus on investing in the national routine systems like DHIS2. And what we found during COVID was those countries where we had invested and worked with the governments, where the governments had prioritized this, we continued to get fantastic data during the emergency. So during the COVID pandemic, so even when services were interrupted, the availability of data from services such as treating wasted children and vitamin A delivery was impressive. In fact, I think we underestimated how well these systems would respond. And then finally, on coordination, UNICEF has a coordination mandate, obviously, but increasingly in the last 10 years, we have focused on subnational level support to coordination. Given many governments are decentralized, they have localized funding. So we have great examples from countries like Bangladesh and Kenya, where that increased investment in subnational coordination on work planning, budget allocation, advocacy, data information makes sure that nutrition is prioritized and gets funded. I'll stop there. Thank you so much, Leslie.
Thank you, Grania. Thanks to all 3 panelists. This was incredibly helpful and informative. I turn it back to Stephanie now. We are running a bit over time. Over to you, Stephanie. Thanks again.
Thanks so much, Leslie and panelists. And indeed, going last but not least, we want to offer Gerda Verberg, who is the coordinator of the Scaling Up Nutrition Movement, just a few minutes to offer us some closing remarks.
Thank you very much. It's great. Yeah, very good. It's great to be in this event because there is a lot of music into my ears about what is happening, especially with the clear examples from the 4 countries, all Sun Movement member countries. And I was very proud to listen to their presentations. But I would like to applaud the N4G and organizers Japan and the GFF for organizing this, because N4G needs to move on from the what when it comes to commitment to the how of commitment, because in the end on nutrition, the proof of the pudding is in the eating, and it needs to reach people, especially children and vulnerable families. So following up of the N4G is one of the center points for the Scaling Up Nutrition movement. 48 out of the 56 country commitments that have been made before or at the Nutrition for Growth Summit were coming from Sun Movement member countries. And thank you all who have contributed to this, because many Sun Movement multi-sectoral, multi-stakeholder members have contributed to it. Now it has to come true. Now that it needs to be implemented, not only from the Nutrition for Growth angle, but including the Food Systems Summit commitments, where there are already 108 national food pathways presented, where countries want to work on making their food system more sustainable and more nutritious for healthy and nutritious food. How to combine this? Let me tell how we are working on this with our members, our member countries, but also our global members. We need to analyze the commitments of the N4G, and thanks to the compact, this is very well done by the Global Nutrition Report. Then we are translating it, and Guatemala was already hinting at the joint annual assessment, where all the players come together to translate the commitment, national commitment, but also the global commitments into concrete action plans. And then do, of course, the baseline and set up the monitoring. And then we go to the governments, because first the domestic funding need to be there. This is the best move of ownership of a country, domestic funding. But of course, we all know that governments will not be able to pay for every commitment. And there is a crucial point, that the international partners and players align behind government commitments and priority, align behind the government, because the presenters of the countries were too shy to mention it here. But a part of governance that needs to also be scrutinized and encouraged is the global partners or the regional partners alignment at the country level. Collaborate, 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 because in the end, it's the countries that needs to do it. Then, of course, the action, the action, the impact, and the celebration of impact that needs to be, or the impact that needs to be measured, of course. Could it be publicized, but also celebrated, because that is the best way to continue further collaboration. Make sure that results can be owned by the people themselves. And for that reason, I loved and embraced the paper that was drafted by GFF. What I was missing a little bit there was the investment in capacity development, capability development was mentioned by the countries. I was missing it a little bit, and the need for systems change. How to build it into the health system, how to build it into the food, social protection, education, if you want, water and sanitation, how to build it in the systemic change. I very much like the remarks of Sean about the investment inquiry on how to align and join forces at country level. This is the other part of government where we all need to work together. And finally, since this all was music to my ears, and the Sun Movement and the GFF are already working so very well together, I will take another step and sort out with the GFF together with the Japanese Trust Fund, how we can even further strengthen and be each other's supporter and align even further, so that we avoid duplication and scale up impact and nutrition results that can be owned by the people themselves. Thank you very much for having me.
Thank you very much. What a powerful and positive note to end on, and a call to action for all of us to take into consideration. At this point, I know we've gone a few minutes over. Thank you everyone for hanging with us. Want to wish you well. Reminder that next week's Nutrition Financing Week has more of these kinds of discussions. If you'd like to engage and learn even more, please do tune in. Otherwise, we wish you all a wonderful rest of your day or a wonderful evening. Take care, and thank you.
Thank you all. Thank you.
Thank you. Thanks, everyone.
Thanks, everybody.